Good day everyone, I am July Sabolundo and today I will be performing my recording demonstration on perineal suturing or perineal repair. So, the first thing that we have to do is to gather all the necessary equipments. This is for the procedure to run smoothly and systematically.
So as you can see, we have gathered all our equipments. So we have the chicken, which serves as our perineum. We also have the lidocaine, needle holder, tissue forceps with teeth, iris scissors, sponge, and our suture, Vicryl OCT, which is the only available suture I can use.
So now, assuming that I have already washed my hands, and now I will be performing gowning and gloving. So now, as you can see, I have already performed the hand washing, gowning, and gloving. So this is to maintain or establish a sterile barrier during the medical and surgical procedure, which prevents the transfer of microorganisms, thereby protecting patient from infection and us healthcare team from contamination.
So before we can start repairing the perineum, we will first give our local anesthesia. So I have here a 10 cc lidocaine. This is to numb the area, reducing the pain and discomfort associated with perineal tear. As a midwife, we are only allowed to suture first and second degree laceration, as it only affects the skin and vaginal mucosa, and second degree tears, it extends deeper to involve the perineal muscles. Meanwhile, the third degree tears involves the anal sphincter muscle, and the fourth degree tears is the most severe, extending through the anal sphincter and into the rectal mucosa, which requires more complex surgical techniques and anesthesia that are beyond the scope of midwifery practice. The simple interrupted suture provides secure closure, especially for deeper laceration, and allows for individual tensioning and adjustment of each stitch.
So now, we will proceed with continuous lock suture.
As for the continuous lock suture, it reduces postpartum pain, requires less analgesia, and decreases the likelihood of suture removal compared to interrupted sutures.